So fibroids are benign growths of the myometrium of the uterus. And if you pick up any medical textbook, it will tell you that the lifetime probability of developing these tumors is about 25 to 30%. But in a groundbreaking study that was conducted about a decade ago, where a random sample of women from an HMO were screened with ultrasound, it found that the true lifetime prevalence of the condition was more like 70 to 80% of women. And if we look at the estimated rates for inpatient hospitalization for reproductive age women in the United States, fibroids is the primary indication for inpatient hospitalization. And that's because it accounts for nearly 40% of all hysterectomies performed in the United States. And when we translate that into healthcare costs, that's about $9 billion in healthcare costs annually in the United States. And when you add in all the costs associated with lost work productivity, purchasing menstrual pads, etc., then the costs exceed over $30 billion US. So fibroids are a huge public health problem. Fibroids are also a silent health disparity, and what I mean by that is that Black women have 2 to 3 times the rate of fibroids of white women, and we don't know why. None of the established risk factors have been able to explain that health disparity in rates. Black women are also much more likely to have an earlier age at diagnosis, an earlier age at first hysterectomy. They're also more likely to have larger tumors and more numerous tumors at the time of clinical presentation. Again, we don't know why Black women disproportionately are affected by this condition relative to white women. A very promising new hypothesis that has come out of the literature based on some preliminary data from cross-sectional and case control studies are that vitamin D deficiency might contribute to this health disparity in rates. These studies have shown that women with vitamin D deficiency or low levels of vitamin D in their blood have a higher risk of fibroids. So the next step would be to confirm those findings in prospective cohort studies where issues of temporality are not a concern.